am Dr. Shalmali. I am a consultant physician and an adult infectious disease specialist at Kokilaben Dhirubhai Ambani Hospital. Today I will be talking about various fevers and causes of fevers. So what is fever? Fever is any body temperature that is more than 99 degrees Fahrenheit taken in the axillary region, that is under your armpit, or more than 99.5 degrees Fahrenheit taken under your tongue, or an oral temperature. So whenever we have fever, it is usually a manifestation of an underlying disease, and we classify these fevers as acute fever and chronic fevers. Acute fever is any fever that lasts less than 7 days. Chronic fever is any fever that lasts more than 14 days. When after investigations we cannot find a cause for your fever, then we classify these fevers as pyrexia of unknown origin or fever of unknown origin. Now, what are the symptoms of fever? The commonest symptoms of fever is feeling chilly or shivering or rigors. Along with that, you may have body ache, muscle pain, severe headache, photophobia. These are the various symptoms that are associated with fever. In addition to that, depending upon the cause of the fever, you may have additional symptoms. For example, if the fever is because of any viral upper respiratory tract infection, then you will usually have running nose or cough associated with it. If the fever is because of a pneumonia, then you may have cough, bloody sputum, breathlessness associated with it. If the fever is because of any infection in the urinary tract, then it may be you may have burning micturition, that is burning while passing urine, pain while passing urine, or frequency of micturition. All of these symptoms may be associated with that fever depending upon the cause of the fever. Now, if you have to classify the causes of fever, then I will go organ wise. So usually you may the fevers which are less than 7 days duration are viral fevers. They can occur because of an upper respiratory tract infection where you have running nose, cough, cold. So common viruses which cause fever would be your respiratory syncytial virus, that is RSV, influenza virus in adults, that is influenza A and B, or now more commonly you can also have COVID-19, which can cause fever and an upper respiratory tract infection. The other causes of fever, if you go to the lungs, then it would be a pneumonia. Pneumonia is usually an infection of the lungs, and it can be caused by various bacteria. The commonest bacteria that cause pneumonia is Streptococcus pneumoniae, which is a gram-positive bacteria which requires antibiotics for its treatment. The other common causes of fever would be gastroenteritis, that is loose motions. Most commonly loose motions are because of a viral illness, and commonly we do not give antibiotics for viral gastroenteritis. However, unless and until we suspect any bacterial cause for this particular gastroenteritis. So most commonly the treatment would be symptomatic. The other common cause of fever would be urinary tract infection. So in urinary tract infection is most commonly a bacterial infection. The most common bacteria would be gram-negative bacteria such as E. coli. Treatment would be with IV antibiotics or oral antibiotics depending upon the severity of the disease.